Thanks, Bill. All right, we're just a little bit after noon here, so we will get started. We're going to record this and put this up um, for any latecomers. So this is being recorded for reference. If anyone has any questions while we're walking through this, please don't be afraid to just unmute and ask. I won't be offended if you interrupt me. So thanks everyone for participating in the challenge set for the fall, and we'll get started. So if I can change screens, there we go. So we had 13 labs, either fully or we had a couple of labs who didn't complete all three challenges, but not all labs perform cultures on every specimen type, so that's okay. But here's kind of where our labs were. A good even spread from east to west. And here's the overview of the biochemical tests we're running. Everyone is running the gram stain, the catalase, and the oxidase, and then varying degrees of urease and indoles and beta lactamase. So that's just kind of an overview of the labs who participated. And so we'll just jump in to our first challenge. Excuse me. So for challenge set number 4, a 39-year-old man presented to a Mississippi hospital with fever, in acute respiratory distress, multi-system organ failure after 1 week of fatigue, weakness, lost appetite, dyspnea at rest, productive cough. He was admitted to the intensive care unit with bilateral multi-lobe pneumonia and sepsis. So these were blood cultures that went positive after 48 hours. So we're going to start with the gram stain. Blood cultures go positive. Normally, gram stain happens with that alert. And so you could see here we had pretty unanimous on the gram negative, and then almost everyone reporting gram negative bacilli. And so similar to last time, we kind of ran through these as well. So we worked them just like you would in your lab. So we did the gram stain, and this was our gram stain for this organism. Clearly a gram negative rod. Nice long gram negative rod there. So if we're following along in our benchtop guide, the NPHL benchtop guide, we have 2 gram negative rods that are on our list. Burkholderia pseudomallei and Yersinia pestis. So for this first challenge, those are the 2 organisms we're going to kind of be leaning toward just based on the gram stain. And so we'll have a look at our reported plate growth. Everyone agreed we had growth on the blood and the chocolate. And then we had most labs saying growth on the MAC, 1 lab reporting no growth. And then the CNA, some mixed results there. So the growth we had here at NPHL, this is our chocolate at 24 hours. Kind of small. Looks like it might be growing all right. The blood plate, again, very small colonies at this point. And then here's our MacConkey at 24 hours. Very little to no growth. So slow growing gram negative rod that grows better on chocolate and blood than it does on MacConkey is always something to keep an eye out for. Here we have our growth at 48 hours. You got the 24 on top and the 48 on bottom. We're just kind of comparing the growth on the plates. This would be our blood. And then here our MacConkey, a little bit better growth at day 2, but we're still not getting out into that secondary and tertiary streak of growth like on our blood and chocolate. So as our survey was concerned, we asked whether you thought this was alpha, beta, or non-hemolytic. Most labs answered non-hemolytic. And I would agree with that. Here's our blood plate. Not a lot of hemolysis showing. For the McConkey growth, kind of had a mixed response here between lactose fermenter and non-fermenter. If we look at our 24-hour growth here, you can see there's starting to be some pigment there. And I think I have a picture of our 24-hour growth, but it's sort of pigmented, almost more like a Pseudomonas might be, but it's not like a real deep pink like you would expect from a lactose fermenter. So this here is what we're calling a lactose non-fermenter. We're going back to our bench guide. We have the two organisms that we're going to pay attention to based on our gram stain, Yersinia pestis and Burkholderia pseudomallii. And so this is where we're going to get into our biochemical tests. And if we can see right underneath our red triangles here, we're performing these manipulations in the BSL. And the first test we're going to start with is our oxidase, Yersinia pestis being negative, and Burkholderia pseudomallii being positive. So that's going to be our first differentiating test. These are our survey responses for biochemical tests. Of the labs that did the oxidase test, yeah, we kind of had mixed results there. 7 labs saying positive and 6 labs saying negative or not performed. Here's the results from our laboratory testing. On the left there is our control. You can see the left side control is our positive control, a little bit of blue coloration there. No color on the right would be our negative control. And then the picture on the far right is our organism test. So you can see it's starting to turn blue there. So we have a positive oxidase for this first organism. So that eliminates Yersinia pestis from our algorithm here. So now we're going to start paying closer attention to Burkholderia pseudomallii as a possible candidate for this organism. Sorry, does somebody have a question? Did I hear something? Okay. Okay, so just like I mentioned, we're going to keep going down the list of tests for Burkholderia pseudomallii. Up next would be our catalase. And we had a majority of labs saying that this one was catalase positive. Looks like 3 negatives and 2 not performed. Here's our catalase test at NPHL. You can see some nice big bubbles in there, like our positive control on the left. So this is a positive tube catalase test. And then next up on the list is indole. If we're going straight down, had a majority indole negative for this test, 1 positive, 4 not performed. Here's our indole test. It's faint, but on the left-hand side there of our controls, you can see a little bit of blue coloration for the positive, and then you can maybe almost kind of see there's like a little bit of red or a little bit of pink in the middle of the negative control, and that's what we're seeing. That's what we're seeing in our actual specimen indole test. A little bit of that pink coloration. So we have a negative indole here, which tracks right along with our Burkholderia pseudomallii. And finally, we're going to do the tube motility. And let's see here. So we're kind of even across the board here. 3 labs said tube motility positive. We had 4 that said negative and 4 that did not perform. And I know I've been saying this a lot, but we understand that in some interpretations of the REML tube motility can be difficult at times. And so at this point, we're advising if it's questionable or you're not comfortable calling it one way or the other, don't and refer it. Don't use that motility as a test to rule out something if you can't properly interpret it, just refer the isolate to NPHL. It's better to be safe than sorry. Or you could always call us if you have a question about anything. So, like I said, here's the tube motility we had here at Nebraska Medicine. We have our controls on top. The one on the left is positive. The one on the right is negative. Kind of tough to see. You can see a little bit more of the pattern peeking through the motility in our negative control. So similarly to our test, our isolate test on the bottom there, kind of fuzzy, looking through the middle. This one I would call more positive than negative, but it is tough to interpret. So if you are unsure, refer it to NPHL. But on our algorithm here, the tube motility for Burkholderia pseudomallei is positive. So at this point, we have some additional testing down here, optional, so not needed. But so right now, we would reach this big stop sign. We cannot rule out Burkholderia pseudomallei. So here's our responses. So at this point, we should have been referring this to NPHL. We had 4 labs call it a non-BT culture. Let's see here, 5 labs who could not rule out Burkholderia pseudomallei. 1 lab unable to rule out mallei. And then we've got Yersinia pestis. So that's kind of where we landed. What we were looking for is unable to rule out Burkholderia pseudomallei. That was the intended response for this first one. Are there any questions about how we got there? Okay. And again, if you ever do come up with any questions or anything, and you want some more explanation, feel free to call or email me if you would rather talk offline. But so, and what this was, the organism was actually a Burkholderia thailandensis, which, as the CAP survey people have mentioned, is undistinguishable from Burkholderia pseudomallei in a laboratory setting. So that's what we were going for there. Okay, we'll move on to number 2 or number 5. It's a 55-year-old male presented with a painful swollen left leg, failed to heal over the course of 2 weeks, type 2 diabetes, increased risk of wound infection. He had a minor scrape while gardening. The wound was erythematous, warm to the touch, and had purulent discharge. Culture collected E-swab, so we have a wound swab here on a leg wound. So again, going back to the Gram stain, we have a unanimous decision that this was a gram-positive bacilli. Here's the NPHL Gram stain. We would agree with you, gram-positive bacilli, big, kind of boxcar-shaped bacilli, and you can see a couple of them are decolorizing rather easily. So just based on the Gram stain, that Gram stain morphology, we're going to start thinking about Bacillus anthracis. It's our only gram-positive rod on our list of things to watch out for. So here was the response for the growth on the survey. We had most labs reporting growth on blood and chocolate and no growth on the MAC. We had some labs reporting growth and no growth on the CA and the CNA, the PEA. So if we look at the growth that we had here at NPHL, here was day 1, 24 hours. Here's our 48-hour plate. And then, of course, the MacConkey, no growth there, which we would expect as a gram-positive rod. We're not expecting too much growth on the MacConkey plate. And here we have our 24 on top and 48-hour growth below. Here's our blood. And then failure to grow on the MacConkey at 48 hours. which we would expect. So for the blood plate, most labs reporting no hemolysis. So for here we are, here's the top and bottom of this plate. Yeah, I would agree that there's no hemolysis, definitely no beta hemolysis on this one. The McConkey growth, this is kind of a throwaway question because it didn't grow. So I guess you could have chosen any three of these responses, but we didn't really give you an option for it didn't grow. So we'll pay closer attention to that last time. But yeah, no growth in the McConkey. So we're swinging back around to investigate our possible Bacillus anthracis. And so here we go. Starting at the top, we're looking for large gram-positive rods. May appear encapsulated. Didn't see much encapsulation on R-gram stain. We look for large colonies, flight to slightly convex, regular edge with those comma projections or the Medusa head. And it's going to be like a tenacious colony. This would be our tenacious colony, a kind of like what did you say, like a whipped egg whites, it's kind of it'll stick up on its own. But if we move down, we're then checking for hemolysis. So if you saw beta hemolysis on that first day, that would lead you to rule out. But we mostly agree that this was non-hemolytic, which here's a picture of our plate, non-hemolytic. So we're going to keep moving to the next page of our rule out algorithm. So then we move on to the tube catalase, which our laboratories, we had a pretty unanimous positive tube catalase being reported from the participating labs. Here was our tube catalase, clearly positive. You got nice big bubbles inside that tube, like our positive on the left here. Okay, following the algorithm, positive catalase, move on to motility. Again, with the caveat that if it says here, if this is negative or questionable, just refer it to NPHL. So for the motility, we had a majority negative, and we had about 5 labs not performing and 1 positive. So here's our motility. It's tough to tell. This one I would probably refer, honestly. Maybe I'm leaning a little bit more toward the negative side. But that's a difficult one. Does anyone have any questions or need any clarifications about all of this motility nonsense? Becky and I are going to investigate options for motility over the winter. Hopefully, we'll get that done over the winter, and we're either going to try to provide some better guidance or maybe return to sending out motility.
Ben, you made the comment about the REML ones kind of giving those false positive reactions on motility. Does BD work better? We're just kind of in that spot where we're kind of stuck with REML because of our purchasing group contract.
Yeah. We are going to do a multimedia study over the winter. We're going to break out our old recipe and we're going to test that against the REML and the BD and some options with the indicators built in to try and figure out what might the best option be out there. Because I know the one that we used to make works very well. It just becomes an issue of
cost,
time and supplies. yeah, and cost. So we're trying to figure it out. I think, right now we're probably recommending not leaning on the motility so much. And if you make it that far with an organism that requires a motility, referring it. Yeah. So having said that, we had a lot of labs um, unable to rule out the Bacillus anthracis, and that would make sense if you had difficulty or you didn't do if you had difficulty interpreting or you didn't do the motility. But the one thing I would like to bring your attention to here is the colony morphology that we're looking for when it comes to Bacillus anthracis. We're looking for that, gray ground glass Medusa head with the common projections, non-hemolytic. So for this organism, here's our 24-hour growth. It's kind of like a tannish, but it's really round and almost kind of mucoidy colony type. They're both non-hemolytic, but if we compare our 24 and 48-hour growth, we've got our organism on the left here, and that's a Bacillus anthracis on the right. You can see some pretty big differences in colony morphology. And kind of along these edges here, you can see that kind of shiny, almost mucoid look reflecting some of the light there, and maybe some on there too. So based on colony morphology, we could kind of steer away from Bacillus anthracis and rule this one out just from the colony morphology. If you decided to go through with the testing and you weren't able to rule out Bacillus and you called NPHL, we would probably question the morphology as far as a rule out goes. This organism was a Bacillus megatherium. So it's another Bacillus, gram stain, big boxy gram positive rod, just not following along with that morphology that we're looking for anthrax. Is there any questions about that? It was kind of a trick play. So last one. 63-year-old female, the emergency department. She came from her doctor's office. She had shortness of breath, non-productive cough, increasing bilateral peripheral edema, kidney transplant 14 years prior, and she is on immunosuppressive therapy. Blood cultures were drawn, and they were positive on day 4. So for our growth, we had agreement across all of our laboratories that this grew on the blood, the chocolate, and the MAC. So let's have a look at what that growth looked like. So on the chocolate plate here at 24 hours, there is some growth. Colonies are maybe a little bit larger than pinpoint at this time. They're a little bit smaller on the blood plate. Not really extending out as far. And kind of similar to our first one, we sort of have this small, tiny, light, almost pigmented growth in the MacConkey. Move on to, I didn't change my number up there. So this is number 6. Yeah, up here at the top, I forgot to change that. Just pay attention to what number we're on. So here at 48 hours, you can see we got growth is a little bit bigger. It's kind of starting to extend itself out away from the center there. On the blood plate, kind of big grayish colonies. Little more growth on the MacConkey. This, again, I feel like has some pigmentation to it, but not really like a pink lactose fermenter, like we would see with maybe an E. coli. And for gram stain, we all said gram negative, and then we had a couple of different responses for the morphology. Majority saying bacilli. We had a coccobacilli and a couple of diplococci. So here's our gram stain. And I can see where there would be some confusion because these are kind of like short, fat gram negative rods. Some of them are pretty tiny. I would say These are still a little bit too large to call a coccobacilli. And then maybe for a couple of these, like on this one here, you can kind of see we've got two of them still, again, a bit large if you're going to try to call that a diplococci. But definitely gram negative. Yeah, short fat gram negative rods. So similar to our first challenge organism, we're led back to the gram negative rods. So we're going to be looking at Burkholderia pseudomallii and Yersinia pestis. For our blood growth, we had majority labs calling non-hemolytic. One lab said alpha hemolytic. Here's our blood. And while we started to maybe see a little bit of gray around the edges of those, I don't know if I would call it like that, that green alpha hemolysis. Kind of some discrepancies again with the MacConkeys. Most labs saying non-fermenter, a couple of them saying fermenter. We talked about this a little bit up top. A little bit of pigmentation, but not really like a deep pink lactose fermenter. So if we go back to our 2 gram negative rods, I'm going to start with the oxidase test at the top to differentiate these two. Most labs saying oxidase negative, 2 labs saying oxidase positive. Here's what we had. Positive control on the left. So on the far right there, not really seeing any pigmentation on that filter paper. So we call this oxidase negative, which is going to rule out our other gram negative rod, Burkholderia pseudomallii, in favor of Yersinia pestis. Go on to the catalase, majority positive in the tube catalase. So here's ours. Yeah, there's a lot of bubbles there. That one pretty clearly positive tube catalase. So we keep following our Yersinia pestis. Up next is indole negative. And so we had about 6 labs reporting a negative indole test, 6 labs reporting that they did not perform the indole test. Here's what we had at NPHL. This was our organism. You could see that kind of faint blue in the middle there, which would indicate that this would be indole positive. So we had some discrepancies there. And when I was looking this up, this organism could be either or. The one we had here is indole positive. It's the same one that we sent out to all the labs. So I'm not sure where the discrepancy there is. We may have to do some looking into that if most everyone is getting indole negative when it should be positive, because that there would have ruled out Yersinia pestis. So for the labs that, for everyone else who is still following along in the algorithm, or you didn't perform it, you don't perform a test, wherever you stop in the algorithm, wherever you stop the testing, you should refer it at that point if you can't perform all the tests in the algorithm. Lost my train of thought there. Okay, so up next is the urease. Majority negative, some labs not performing. Urease here at NPHL was negative. And then it brings us back to our faded motility. That'd be about 5 labs said negative motility and 7 of them not performing. So here is our incubated motility. I think this is tough to tell. I could probably go either way with this. I would be referring it at this point. I want to have you look at, we have our room temperature motility on the left and incubated motility on the right. If I had to choose between these two, I would say the room temperature motility is a little bit cloudier than the 35 degree. But again, tough to tell. That would be let me flip back here. The difference between the room temperature and the 35-degree motility would also be a rule out. Yersinia pestis is non-motile at both room temperature and in the incubator. Other Yersinia species will be motile at room temperature, but non-motile at 35 degrees. So that's why I bring that up. And so here we had our responses. Most labs reporting non-BT culture, which is correct. I think with all of the labs we had that were reporting indole negative, we probably should have seen a couple more unable to rule out Yersinia pestis. We had 2 labs that were unable to rule it out. And then the pseudomallei, oxidase would have taken you off of that trail, kind of up at the top. So this here was actually a Yersinia enterocolytica, so not Yersinia pestis. That motility at the room temp and 35 degrees would have been another rule out step for this Yersinia. Are there any questions following our third challenge there? Any questions regarding the fall challenge set overall? Okay, well, that's all I have for you for this challenge set. Expect to be hearing from us about the motility moving forward and the gram stain challenge later this month. Yeah, about halfway through this month, we're gonna start prepping to send out the gram stain challenge too. If you are participating in that, you can look forward to it. So yeah, that's everything. If you do ever have any questions, feel free to email me or call me. I'm happy to answer them, happy to talk about them. So thank you everyone for participating, and we'll see you later.
Thanks, Ben.
Thank you very much.